Hello, everybody, and welcome to our third episode of Cancer Coaches Corner. I'm here with two other fabulous women, Hayley Dubin and Ann Ferrier-Crook, and we are all integrative nutrition health coaches. We are all cancer survivors, and we all now work with cancer patients primarily at the end of when active treatment is done, to help them move forward and begin to live a healthier, more robust life. And today we are here to talk about a really important topic. Today we're going to be talking about how to navigate the fear of recurrence. And I want to jump right into it, right? Because it's a big topic and we've got a lot to talk about. And if you're on live with us, please pop into the comments, say hi, let us know where you're coming in from. But let's just dive right in. Hayley, how do you navigate fear? Now, I know your cancer diagnosis was a while ago, so maybe you can speak to that and whether it still exists at this point for you.
Well, thank you. I'm so happy to be here with all of you. But I actually, in May 2nd, will be my 25-year cancer anniversary. I had ovarian cancer, for those watching that don't know. And it's interesting because obviously as time goes by, the fear does lessen a lot. I talk to people all the time that have different pains or, things that just feel different than they used to. And it's so normal to get nervous. Oh my gosh, what is this? Could it be cancer returning? What is it? And, those things still happen to me. I mean, I might have a weird pain behind my eye. It happened to me like for a week. And one of my rules of thumb is to say, give it over a week. If it doesn't go away in over a week, then go to the doctor, go get tested. So, don't panic. And, I wanted to say that fear, it's okay. It's okay to feel afraid, and don't just, try to change. I mean, it's good to change the subject or try to reframe it, but you could feel it first, I'm scared. What am I scared of? And then you can go to breathing, to take a deep breath. And I know we'll talk about different tips, but I don't know if you have any other questions about navigating it.
No, I love that. Thank you. And I love, even just to hear from somebody that's that far out. I know Anne and I both are closer to our diagnosis. And so I think it's helpful to hear of the hope, right? And the fact that it does lessen, and you, for most of us, become not quite so hypervigilant and anxious all the time. How about you, Anne? How do you navigate the fear of recurrence?
Well, first I want to honor Hayley's 25th anniversary on May 2nd. That's huge. And I just celebrated my 5-year anniversary from breast cancer on April 13th. And I actually felt elated that day. I just felt filled with gratitude and joy that I have a great medical team on board. I just got a mammogram on April 5th that was all clear. I just got my breast thermogram on April 12th, which I still am waiting to get my results back, but it looked really good. But how I navigate fear, because I actually had some fear and anxiety coming up in my body in March, and it kind of blindsided me. It's like, where did this come from? Because I've been feeling amazing for, 3 solid years. I would say I've been feeling really amazing. But what it made me realize is that fear and anxiety kind of get stuck in the nervous system. And there are life events that trigger it. And it's really easy when you're in a moment of fear for your mind to just spiral and be like, oh my God, like, what if I'm going to have a recurrence? Or, and it's really dangerous to go down that rabbit hole. So what I do is I first stop and take a deep breath. And I've been doing this 5 counts in, 5 counts out, and just really tuning into my breath, which is so powerful. And then I actually go out and spend time in nature, and I set really healthy boundaries. Like I was just telling the two of you, I'm moving next month, so I'm not taking private clients for the month of May because I have to get through my move first. And I've just, as I've grown through my cancer healing journey, I've just learned to know my limits and know what I need for self-care and put that front and center. No matter what else is going on, it's like, I've got to come front and center right now. And that way I have more to give to my clients and I have more to give to the world. Um, so I would say those are the three things that come to me: is knowing healthy boundaries, tuning into your breath, getting plenty of sleep, and spending time in nature. Those are my go-tos.
Yeah, I love that. I love that. And I think that we'll go more into tips to use in the moment in a minute, because I think that we're all familiar with that feeling where suddenly we get the rush, right? The rush of fear, the rush of anxiety. But we're just looking at an overall picture right now. So hang tight with us if you're watching, because we are going to dive a little bit deeper and give you some really feasible tips that you can use. So,
and Karin, I wanted to ask you, I know you've been going through some things, and before we talked, you said something really powerful, and I'd love you to share that.
well, I am going through some things, and I think that what happened for me was I found a lump on my chest, which, by the way, I don't think everybody knows that even if you have a mastectomy, we still need to check. We still need to do an exam. That's something that I teach people to do. Whether you've got reconstruction, whether you don't, we still need to continue to do that exam. And I found a lump. And so the first thing that the oncologist wanted me to do was a CAT scan, which we did. And even though the lump looked okay, it actually looks like it's a bit of a deformed rib that's got a lumpy bit on it. As I'm still getting used to my anatomy of being flat, it's interesting just getting used to how your body feels. But what we did find was a nodule in my lung, and we did find some abnormal lymph nodes. She was a bit puzzled because she wasn't linking them to breast cancer. And the report said that these things could be cancer, they could be inflammation, and they could be infection. So what's interesting is me probably 5 years ago would have just heard it could be cancer, and I probably would have shut out the rest of it, right? It's like sometimes that's all we hear. But having just gone through a really bad dose of COVID, I thought it really important to bring this up. And she said that would make sense to me for what we're seeing in the lungs, because they see that it can take up to 12 weeks for the lungs and lymph nodes to respond and kind of settle back down after COVID. So what we decided to do to obviously rule out cancer, because I am high risk, I do carry the BRCA2 genetic mutation, is we're going to be doing a PET scan. The PET scan is not immediate. However, she wants to give those lymph nodes and the nodule time to respond to and heal from COVID. So middle of May, I'll be going through a PET scan. And what we were saying before, and again, it was really interesting, right? I could very easily be on edge. I could very easily be anxious. I could very easily be comfort eating and hibernating and being in fight or flight mode this whole time. And I'm not. I'm not. And part of the reason for that is I know how I feel in my body. And like you were saying, Anne, that you felt fabulous, right? I knew something was wrong before I was diagnosed with breast cancer. I had horrendous back pain that had me in bed all day long. I was seeing all kinds of specialists because I knew something was wrong. I could feel it in my body. And it was only my routine mammogram where we found the breast cancer. As soon as I had my double mastectomy, all of those feelings went away, including the horrendous back pain. So my body was very clearly telling me something's going on. And please don't take it to the worst case. Like, I don't want you to think that, oh my gosh, I've got back pain. That means I've got cancer. No, it doesn't. This was my instance of what my body was showing me. And we're all different. But I do encourage you to listen to that feeling. Is something off? Is something not right? Because that, I believe, is our body speaking to us. But so right now, what am I practicing? I'm practicing a lot of tools, and we'll dive into them in a minute, to help regulate my nervous system. I am getting my body into rest and digest as much as I can. And there's some very simple tools, and we'll share them in a little while. But for me, that's kind of what I'm doing. But there's also this level of trust, this trust in my body, this trust that no matter what these results end up being, that I will be able to navigate it. Mm-hmm. And so for me, that's part of how I personally navigate the fear. Mm-hmm. And so, but I think that it's like you were saying, Hayley, it's very normal for us to experience the fear, especially if we feel a lump, especially if we've got pain somewhere. I think we become hyper vigilant, mm-hmm. checking our body, being aware, and just like, oh no, what's that? Is it cancer again? And just like you were saying, Anne, triggering that survival mode response, triggering when you heard those words, you've got cancer, right? I mean, we can't unhear those words. Mm-hmm. So to me, it's like we can't stop that from coming up, but it's more how do we navigate it when it does?
Mm-hmm. Absolutely.
Yeah. So with that being said, I would love for each of us to share with our viewers some tips that you use in the moment. So when, like you said, that fear explodes, we've got this like feeling, oh my gosh, is it cancer again? What am I going to do? And our mind starts spinning, right? I mean, that's what happens. We start projecting and we start trying to solve all the problems that we don't yet have and all of these things. So, Anne, what do you do mm-hmm. in that moment?
I love this question. I've actually been applying these things. I'm going to share. And I think it's confidence building when we have these tools and we know that like the fear is not going to take me down and my faith is bigger than my fear. And I have these tools. It's very empowering. I've recently gotten re-fascinated with polyvagal theory, which I knew about years ago. But I'm going to be taking a deeper dive into nervous system healing with my professional training because this is a topic I'm passionate about. And I've personally worked through my fears using it, and I want to bring it to my clients. So one thing that I've learned is with polyvagal theory, when I talk about polyvagal theory, it's the vagus nerve. And it's the nerve that connects the brain and the gut between the gut-brain axis. It's like the bidirectional highway because our brain is always communicating with our gut. And it also regulates the nervous system. And so just by taking, actually, if you tilt your head one way and you look up, so you're looking with peripheral vision, and you hold it for about 30 seconds and you just start taking some deep breaths. And then you just come back to center and you take more deep breaths. You notice that immediately you calm down. And it would be hard to go through all the actual movements, but if you want to look it up online, just Google polyvagal theory and deep breathing. And for me personally, what's helped me the most is tapping into my breath. And because most of us breathe from our neck up. And especially when we're in fight flight, we're like, oh my God, and your nervous system feels like you're getting chased by a tiger. And as we know, if we've had cancer, we cannot be in that state, fight or flight, because that actually encourages cancer pathways too. So for me, when I get into that place, I'm like, okay, let's just focus on this moment. We don't need to tackle tomorrow yet. We just need to get through today. And let's just calm down and just learning these movements where you look up something with the peripheral vision. helps to trigger the vagus nerve, what I've learned through my research. And then you just hold these postures. And then another thing is just legs up. So you lie flat on your back and you put your legs up on the wall and you just rest there. It's in restorative yoga classes a lot. And that puts your body in rest and digest, which is the parasympathetic nervous system. So these are just some things that I do that help me a lot, just with breath and certain movements.
I love them. The tilting with the peripheral vision is a new one for me. So I'm going to try that. Legs up the wall is one of my favorites. And because it's just, it works. I mean, this is the thing. And I love the simplicity, right? I mean, that's the thing. These things are simple. We're in this fight or flight, being chased by a tiger. We want simple, simple, simple. How about you, Hayley? What's your tips for what do you do in that moment?
So one of the first things I do is put my hand over my heart and my hand on my belly and just say to myself, I am safe in my body. And it just calms me down. Also, getting outside, I know Anne mentioned that, but even if I'm not going for a walk, I go in the backyard and just breathe and listen to the birds. You know, that's a form of meditation. You don't have to have this whole, you know, people think meditation is the whole big thing where it's, you know, you're sitting for hours, but no, just listening to the birds, smelling the fresh air, using your senses as much as you can to get you in the present moment. That helps me so much. And breath work. You know, there's this great technique and it's really easy and we can do it right now if anyone wants to. Just breathing into the count of 4 and then holding your breath for the count of 2 and then releasing the count of 4 again. So maybe we'll all try it and hopefully people watching can try it.
Yeah. Let's do it. Let's dive in. I'm always down for some breath work.
Your other hand on your belly and just breathe in for 4 seconds and hold for 2 and release for 4. Maybe we'll do it one more time. Breathe in for 4. Hold for 2. And let go for 4. And can't you just feel calmer as you do that? And I was just going to mention one other thing because tapping has been something that I've been learning for a while. And people it's using different meridian points, but people could just go online and look up Nick Ortner. There's other people, but he's a really good one. And you look up a YouTube video and you can see how to do it. But it's really great for releasing fear. So yeah, so that's a few things.
Love it. Yeah, thank you, Hayley. Yeah, and again, the simplicity, right? And I think that, and you'll notice as I share mine too, there's something that they all share in common, and this is our breath. I think that in society, we've forgotten how important our breath is and how by changing how we breathe, we can change our state from fight or flight to rest and digest, from our sympathetic to our parasympathetic nervous system. Where we want to live in that parasympathetic nervous system. And with that being said, one of my favorites, I mean, you've both mentioned things that I do too, and I tend to put both hands over my heart and say, I love you, you are safe. And I think that, I mean, it's so simple, but please don't underestimate the value of these simplistic tools. We overcomplicate life. We make it so like it has to be really complicated for it to be worthwhile, when in actuality, and I'd love to hear from both of you, I know for me, the simpler that I've made it, the more effective these tools have become. Right.
Absolutely.
Absolutely.
When we're in that fear state, we don't want complicated. We're already at the, hanging on by a thread. So my favorite, and it speaks to tapping, Hayley, like you were saying, and I love Nick Ortner too, is I do something, and feel free to follow along again. I do something called the butterfly. And it is, again, one of these instantaneous shifts from sympathetic to parasympathetic nervous system. And so if you put your hands towards you, cross your arms, link your thumbs, making a butterfly, and you're going to put your hands on your chest so that your fingertips just touch just below your collarbone. And you slowly and gently alternate the tap from one hand to the other. Now you can sit and you can just do that. Or we can add in breath work, which it's like doubling down on something that's good for you. So if you wanted to, you could do this and just integrate Hayley's breath work that she's just done. But again, if you are doing this, by now, you should be feeling a little bit calmer. It works so great. And you can do it anywhere, right? Anywhere. So I love this. It's one of my favorites. I do it all the time. And, it's that simple. So that's one of my favorite things. I agree with all of yours. Go for a walk, stick your head out of the door, breathe in fresh air, put your feet on the earth, hug a tree. And I know, you may think, Karin, really? It's been scientifically proven that when we connect with our earth, there's an energy that we pick up, and it's a calming energy.
Absolutely. And I want to just add one thing, and that was such a beautiful demonstration, Karin. I just felt the calm coming through my body. And I love that you both said, hand on your heart, I love you. You are safe. Like, that's so huge. The one that I wanted to add is the alternate nostril breathing. I forgot to mention earlier. So when we close our right nostril and we breathe in through the left side, if you just practice this for a minute, let's just take a few simple deep breaths in through the left nostril. What I've learned is this side actually activates the parasympathetic nervous system. And if you want to just focus on breathing in through the left side to get that parasympathetic, the rest and digest nervous system activated, that's very calming. Or you can actually alternate. And so you can actually alternate. So you would actually inhale in through the left side, closing your right nostril. To the count of 5, hold it for several seconds. And then you exhale out through the right nostril, closing the left. So you're alternating. So you're always alternating on the exhale, and you're inhaling on the same side, if that makes sense. So just do several rounds of that.
Does it matter, Anne, which side you're inhaling and exhaling? Is there any more benefit to inhaling on the left, like you said, and exhaling on the right?
Well, you're always actually changing sides when you're inhaling, when you're doing the alternate breathing.
Okay.
But if that's too complex for people and they're just like, that's too many details, then what I've learned is that when you just close the right nostril and you close your eyes and you just breathe in and out through the left nostril, that actually activates the parasympathetic nervous system.
Love it, love it, love it. And
I'm so sorry, but you reminded Karin of one other thing when you said about hugging the tree. Getting your feet in the bare grass or the sand or just the earth, it's called grounding, and it just makes you feel so calm. I do it all the time when I'm out gardening, and it helps your sleep. So a bonus that it will help your sleep.
Yeah. And these, for some of you that might be new to these ideas, you may be thinking, oh, that sounds a bit woo-woo. Give me a to-do list of things versus these things. But trust me, we have all played around quite a lot with these different ideas and different tools to find what works for us. I have a very robust toolbox of things that I can tap into, as does Hayley and Anne. And I think we can all agree, right? It's these super simple things that when we're in that state, it's these things that really work. I know for me it certainly is. So give it a shot. Don't poo-poo it until you've tried it. Try these on, see if any of them work for you. That's all. But I love that. So what I'd also like to know is how each of you help your clients navigate the fear of recurrence, because I know that obviously we share the same tools with our clients, but what if you have somebody that isn't used to doing this, who struggles with sitting still, who struggles with a lot of anxiety all the time coming from this fear? And Hayley, perhaps you want to start off and let us know, how do you help your clients with that?
Yeah, I'll ask them, what's one thing they can do today that really will represent them being healthy, alive, or feeling good? So, what is that one thing that you can do? Because people they get overwhelmed when they get a cancer diagnosis. Even when cancer's treatments dip over, it's like, oh my gosh, what do I do now? So if you can just do one thing, what would that one thing be? And, it could be going outside, like we said, and just listening to the birds chirp. Just make it small, not overwhelming.
Yeah, I love that. Just focusing on that one thing and finding out what that one thing is for everybody, right, will be perhaps a little different. And it's not that there's any right or wrong. It's finding what works for you. I love that. Yeah, keeping it simple. Thanks, Hayley. How about you, Anne? What do you do with your clients to help them navigate the fear of recurrence?
Well, I love the idea of keeping it simple. That's huge. Not overwhelming ourselves, because a cancer diagnosis is overwhelming and so much feels out of our control. So it's giving my clients the power of knowing the things they can do to take back control of their health. And so I always say knowledge is power. And when I teach them about the nutrition that they can eat, that is, cancer prevention and getting optimal sleep, is huge, and just giving them some very specific tools they can use on a day-to-day basis is manageable. That's one thing. Another thing I offer my clients are holding space sessions. So we go into the emotional healing of, and oftentimes what comes up is the inner child, which is, some people might not be familiar with that term, but we all have an inner child that lives in our body from when we were, very young, and we didn't know how to navigate life events on our own that were overwhelming. So we learn these coping strategies that put us in fight and flight often. And so when we go back and we actually turn towards that younger part of ourselves, like what you were both saying is, I love you, you are safe. We are actually speaking that into our body, into our cells, into our inner child. And when we can calm down that younger part of us that's in fear and know that there's somebody here that's capable, that's got you. I love you. I'm here. I'm not going anywhere. It's amazing how that calms the nervous system down. So I've been doing some really deep work with my private clients around that theme, and it's been a game changer for them. So that's something that I work with.
Love that. Absolutely love that. And I think for me, what I try to do is, first of all, shift a mindset, right? I say to my clients, would you like to walk into your next appointment, your next test, your next scan, the way that you would walking into an exam that you've studied for, that you know you've done the best that you can, and you're walking in and you're saying, you know what, I've done what I can, the rest is in God's hands, right? Or the universe, or whatever your belief might be. versus going into that appointment saying, oh my gosh, I didn't study, I didn't change anything, I didn't do anything, like the chances are going to be so much higher. And already energetically, you can feel the difference in how you are walking into that appointment. And so for me, that becomes the first choice with my clients. How do you want to present yourself and walk into your next test? There's going to be anxiety, just as there was when you were in school walking in to take an exam. You're going to be anxious. So accepting that. But do you want to walk in knowing that you've changed nothing? Or do you want to walk in knowing that you've made some changes that are going to serve you for the better, to help keep you healthy? And for me, yes, nutrition, managing stress, toxins around the home. But the primary thing for me that I see helps my clients make the biggest shift is to put their needs first, to stop putting their needs on the back burner and focusing on everybody else, and doing it without feeling guilty. And for me, that is one of the biggest shifts that I teach. Because it does, when you're like, okay, well, I'm taking care of myself. So whatever that looks like, and it's different for everybody at every stage, right? If you're new to taking care of yourself, you might just be looking at basics. That's okay. Everybody starts somewhere. If you're more advanced, you're maybe have got 20 things a day that you're doing for yourself. All of them are fantastic, but it's that shift to start saying, I matter enough. I matter enough. And I want to walk into that next scan, test, doctor's appointment, knowing that I have made changes and I am taking care of myself. And so for me, that's one of the biggest shifts.
I love that. And I love what you said about not feeling guilty, because I think that's huge. I think as women, we always feel so guilty about putting ourselves first and taking care of ourselves. And it's such a must when it comes to preventing disease, preventing recurrence, all that, and thriving.
And I love that you're both talking about the shift in mindset, because when we can see cancer as an opportunity to say, how can I grow from this? How can I become a better version of me? Then it actually calms the nervous system as well, to just think of it as a blessing. It's like, oh my gosh, this is a wake-up call. Like, there's something I'm supposed to learn here. And I noticed that when I shifted into that mindset around breast cancer 5 years ago, something calmed in me, where I was like, oh wow, my life is actually going to be better as a result of this, because I get to clean up my blind spots.
Yeah, that's so big. That's so big. And that, to me, is a long-term strategy. You know, we talked about the short term, what we do, being present in our bodies. But what you just said, Anne, I mean, that's for long-term health and overcoming that constant fear of recurrence.
Yeah, definitely. And I think that, again, and there's a common theme here, and that is feeling empowered, right? It's knowing that you can make shifts. Breast cancer, by the way, for those of you that don't know, is known as an environmental disease. And what that means is only 15% of diagnoses are due to genetics. I fall into that category. I carry the BRCA2 genetic mutation, which means that 85% of diagnoses are due to what's known as environmental factors: food, stress, toxins, mindset, unresolved traumas, things like this. That is fantastic, because these are the things that we get to control and do something about. So I think so often when we're fearful, we feel like there's nothing we can do to change a future outcome. I think all three of us would go up in arms and say, no, yes, you can. Yes, you can. Because we know that you can. And so, yeah, right. I mean, it's
the epigenetics that we're talking here. It's like, you know, our genes are not our destiny. Yes. They put us at higher risk, but we have the control over our lifestyle to turn on or off those genes. And so when we think about it that way, we have so much more power than we realize.
Yeah.
And the other thing I want to highlight here, as far as, preventing fear of recurrence, is the importance of community. Just not feeling alone. And when you have other people who've gone through a cancer diagnosis, you're part of a community, you can normalize those fears you're having. That also calms the nervous system.
Yeah, absolutely true. And, with that being said, Anne, wherever you're watching this video, there are links to all of our websites, all of our communities, and also free gifts from all of us. So all of those links you'll find around wherever you're watching this video. And feel free to grab all of them. Don't feel like you have to choose. Go ahead and grab all of them, so that you can be in our communities and get support from people who get it. I mean, this is the big thing. And I hear this all the time, right? And I'll even say there was one time I was on my way to an appointment, and my husband was driving me, who's been amazing and so supportive through this journey. And I was having a rough time. I was actually taking some CBD oil because I was driving and my anxiety was going nuts. And he was just like, I don't get it. Everything's fine. You're going to be okay. And he said it lovingly. It wasn't meant to be dismissive. But in that moment, it's like you don't get it. So no matter how much somebody loves you or cares for you, it's very hard to understand the mental impact that this disease can have on all of us. And so that's why, again, to speak to what you said, and the importance of community and being surrounded by people that get it, being coached by people that get it, is just, it's a must. It's a must, really.
It really is. And especially with people who have gone through a cancer diagnosis and get it. Like you said, our loved ones are great. They love and care about us, and there's value in that community. But if somebody hasn't gone through a cancer diagnosis, they might not understand the impact that it has. What you were saying, 80% of, did you say breast cancer specifically survivors have some form of PTSD? I mean, that's huge.
Yeah.
So just speaking to somebody that understands that is a traumatic life event that happens to somebody, whether it's breast cancer or ovarian cancer or whatever. And, being around people that understand that can uplift you is so important.
Yeah. And living in gratitude, when you said uplift, living in gratitude, it's hard to live in fear when you're living in gratitude. And, just even writing down each evening before you go to bed, 3 to 5 things you're grateful for. It's a game changer.
Yeah. I had once, I remember hearing, hope and fear cannot exist in the same space. And so even just knowing that, you're like, okay, well, do I want to be hopeful or do I want to be fearful? I know which one I choose. So choosing that route as much as possible and implementing all of the things that we've shared here today. So as we wrap it up for today, ladies, is there any last point that you would like to share with our audience around fear and how to navigate that as part of this journey?
Well, one thing I was thinking about is, looking at fear as your companion. Okay, right now I'm feeling fearful, but don't let it be in the driver's seat. Let it to propel you forward to make changes, to, like you both were saying, to look at your life and, what changes can I make? How can I calm my nervous system down? How can I eat better? How can I be in joyful relationships? So looking at, fear to propel you, to fuel you.
Love that. How about you, Anne?
Well, when you asked that, I just immediately thought your faith is so much bigger than your fear. And it doesn't mean that you're not going to have fear. Fear is going to come up. But when we have these tools that we can use in that moment to trust that fear is going to pass, it's energy in the body. And when we can access our courage and our strength and our faith, so whatever helps you tap into that, I would just say, go to that place. to know that you are courageous, to know that you are strong, to know that you are capable. And it's okay if you don't feel it in the moment, but to trust that this is energy in my body. And as I learn these tools to help it move through me, it's just energy like waves. It's almost, I like to think of it as a rebirth in a way, because I was born in April and I was also a certified childbirth doula for years. And so I often think of going through these life events as sort of giving birth in a way to a new part of ourselves. And we're just shedding old layers of fear that we don't need. And we're energetically stepping into this new blueprint of I am safe, I am grounded, I am strong, or whatever those words are that are empowering, but it's really stepping into our empowerment in a bigger way. So that's what I would say. Your faith is bigger than your fear.
I love that. I love that. And I think for me, I used the word trust earlier, right? Trust in my body. And I think that understanding, and it kind of links to what you said too, and with faith, and I want you to remember that your track record for getting through difficult stuff is 100%. 100%. So you might be bumped, you might be bruised, you might be breastless like me, but you are here. And I have so much trust in myself, in my faith, that no matter what, I will continue on this path. And that for me helps me try to stop controlling something that I have no control over. And that's easier said than done. It is a constant awareness, but it's giving up something that we can't change, right? Yes, we have to, yes, we get to change our habits, but the outcome, it's just trusting yourself that no matter what comes your way, that you'll get through it too. So those for me. So wrapping it up today, I want to thank you both immensely for sharing these inner secrets, these small things. Simple, I shouldn't say small. They're simple but mighty tools that we've shared today. We invite you to try them on for size, see what works for you, and come back. Let us know. Let us hear about how, what worked for you, what didn't. We would love to hear. We would love to hear.
Yes, we'd love to hear your comments.
Yeah, drop it below this video, wherever you're watching it, or if you're watching a replay on YouTube or in one of our emails, please respond. Let us know what resonated with you. What are you going to start to take on and give it a shot and try? So, and ladies, I think we will see everybody next month. We don't have our date written down yet, but we will be back next month. If there are any topics you would like to see us covering, let us know. Let us know. We would love to serve you and give you value and help you on this journey as much as is possible. And if we know what you're struggling with, that allows us to step up to the plate and bring you exactly what you need. So again, as we finish up today, you can find all of our information around this video, to connect with us, to visit our websites, and don't forget to grab our free gifts. I know there's so much value just in those. So thank you again for watching, everybody. Hayley, thank you. And thank you so much, my dears. And we will see you next month, everybody. Thanks for watching.
Thank you.
Thank you.